Myeloma is an interesting disease in such a way that tumor burden is a critical marker for differential diagnosis between MGUS, smoldering, and active myeloma, yet tumor burden is not used for risk stratification of patients with active myeloma. And we believe this is so because it is difficult to estimate tumor burden by looking into the amount of plasma cells in the marrow because of the heterogeneous involvement and even extramedullary disease that is associated with myeloma. And because of that, we hypothesized that analyzing circulating tumor cells or CTCs in peripheral blood would be a much better biomarker because it reflects tumor burden beyond a single bone marrow aspirate, number one, and number two, beyond tumor burden, the number of cells in the blood would be a surrogate of the amount of tumor proliferation and disease dissemination. Importantly, there were 3 studies very recently published in the Journal of Clinical Oncology by 3 different cooperative groups, all of them showing the value of assessing CTCs in the blood at the time of diagnosis in active myeloma as one of the most relevant prognostic factors that can be easily added and improve the current revised ISS, and definitely is much more effective as a biomarker of tumor burden when compared to the gold standard, which is the assessment of plasma cell infiltration in the bone marrow using morphology.